It is now Wellness Wednesday time. Yesterday was Epilepsy Awareness Day, but every day millions of Americans live and are very aware of this condition.
And there are many questions associated with epilepsy. Dr. Brandon Brantley is with the Department of Family and Community Medicine with WellStar MCG Health, and he's joining us along with Dr. Deborah Moore-Hill, Chief of the Division of Epilepsy and Neurology Department.
Yes, thanks for joining us. Appreciate it.
Yeah,
Happy to be here.
Start off, what is epilepsy for people that don't know?
Yeah, so epilepsy is characterized as a seizure disorder. And so seizure is an abnormal or excessive amount of electrical activity in the brain that can lead to a multitude of symptoms. So that would be kind of our most simple aspect of what this epilepsy is, and it's fairly common. It's more common than you would think. We're looking at an incidence of about 1 in 100. Chances are you probably know someone with epilepsy, even if you don't know that they are dealing with that.
And Dr. Moore-Hill, patients with epilepsy, can they avoid triggers to prevent a seizure from coming?
So patients with epilepsy are certainly going to have triggers. Sometimes they can avoid those triggers, and that might result in them not experiencing a seizure in that day. Some of the triggers could include physical exertion, overexhaustion, missing sleep, missing medications. Sometimes for women even, they can have seizures that occur more frequently around their menses. Mm-hmm. Sometimes seizures just occur without warning at all. So that might create some social stigma for patients as they might become fearful of going out into public.
Yeah, and talking about that, I mean, if I have epilepsy, can I live a normal life?
You know, the goal of treatment for our patients is so that they can live a normal life. There are lots of treatments that patients with epilepsy can pursue. Generally, the lay people know about medications, but there are so many other options for patients to pursue as well so that they can lead normal lives.
So is there a cure for epilepsy?
Well, it depends. So with some types of seizures, epilepsy surgery can be pursued that could really remove that seizure focus. And so 60 to 80% of patients who have right temporal lobe epilepsy can be cured with epilepsy surgery. For other patients who may not be appropriate for that surgery, we have other options. And thankfully for us here in Augusta, we have a level 4 nationally certified epilepsy center at WellStar MCG Health. So we offer all of those options to our patients.
There you go.
And as a bystander, what should I do if somebody with epilepsy has a seizure in front of me?
So I know seizures can look very scary, right? The first thing is to try to remain calm. You want to remain calm for the patient, make sure they're out of harm's way. You know, if seizures are prolonged or if the patient has taken a long time to come back around to their baseline, or if you're just concerned and it's outside of your comfort and you're unable to deal with it, you might want to call 911. If patients are having convulsions, you would want to turn them onto their side so that any secretions that they might have might come out and they might not swallow those. Right.
And you know, you don't restrain them. And this is something you always see in the TV shows and the movies. People want to put something in their mouth to keep them from biting their tongue or something, and that is a no-no.
That is the worst thing you could do. You could actually cause someone to actually have two problems: a seizure plus they could swallow something. So that would not be a good idea.
Yeah, let's not go that route. Okay. What about patients with epilepsy? What do they do if the seizures don't stop? How can you seek care for that?
Right. So I think with all medical conditions, start with your general practitioner, right? So they're the gateway to all of the other healthcare professionals. They should know that you have that problem. But then outside of that, you should be referred from your general practitioner to an epilepsy specialist. So a lot of patients who are having seizures are just going around and around in the circles doing medications only. We have so many other options, so they need to be referred out to epilepsy specialists like the ones we have at WellStar MCG Health.
Along those lines, where can people get more information for that?
So they can Google us at WellStar MCG Health Comprehensive Epilepsy Center. There's also a wealth of information on the Epilepsy Foundation page.
All right, good stuff. Dealing with epilepsy here. Doctors, thanks so much. Appreciate it.
Thank
all the
you.
information.
Happy to be here. Thanks.
Let's check in.